Hello and welcome to the Quincy Access Television studios. I'm Mark Crosby. Welcome to For Your Health, a program of the Quincy Health Department and Quincy Access Television. Today's topic is understanding mental health. I have Caitlin Kirby as my guide through this topic. Caitlin, welcome back.
Yes, thank you so much for having me, Mark.
Great to have you, as always. We should begin the program, I think, with an overview because it kind of sets the stage.
Yes, of course.
So let's look at what's in store for the next half hour. Mental health and behavioral health statistics in the U.S. What is mental health? What is mental illness? The difference between mental health and mental illness. What causes mental illness? Why mental health is as important as physical health. Symptoms and when to go seek help. Healthy ways to take care of your mental health, and resources.
It's kind of a tongue twister there, all those mental health and mental illness.
Maybe for me.
Yeah.
Maybe not for you so much.
Yeah, well, and I think it's important. As a public health nurse, I'm not a mental health clinician, but I do think it's important, especially where mental health and mental illness are kind of used interchangeably. I do think it's very important to know the differences between the two.
I'm glad you said that because they are used interchangeably and there can be some confusion.
Yes, yeah.
So let's start. Mental health and behavioral health in the U.S.
Yeah, so I thought we'd start with some statistics just because when you hear the numbers in the United States, it is a little bit alarming. So according to the Center for Disease Control and Prevention, mental illnesses are among the most common health conditions in the United States. With more than 50% of people will be diagnosed with a mental illness or disorder at some point in their lifetime. 1 in 5 Americans will experience a mental illness in a given year. 1 in 5 children, either currently or at some point during their life, will have a seriously debilitating mental illness. And 1 in 25 Americans live with a serious mental illness such as schizophrenia, bipolar disorder, or major depression. So those numbers are a little alarming, especially when you look at our children. 1 in 5 children will be experiencing a mental illness in their life. That's very high. So I think, again, it's so important knowing the difference between the two. Of course, each disorder, a lot of the symptoms intertwine. So we're just going over this very baseline today. But yeah, I'll get into the differences between mental health when we're talking about that versus mental illness.
One of the things that I was thinking is that it's more common than folks might have originally known. And with that said, I guess a person experiencing a mental health issue is not experiencing it alone. In other words, there are other people out there that are having the same issues.
Yeah, and you'll see, with generations, as we're learning more, we're connecting more with the internet. So there's a lot of support groups out there people can now access. So 50 years ago, you might have been suffering depression and it was kind of hush-hush. You didn't talk about it. It's kind of frowned upon. And now you realize you're not alone at all. There's so many people that struggle as well as you. Doesn't take away from your individual struggles, but it does help to know you're not alone and that there are sources out there to get help.
Yeah. Well said. So definitions, I always love to include definitions in the topics that we discuss. So we will begin with what is mental health.
Yeah, so our mental health. So mental health includes our emotional, our psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. So this is just an overall state of well-being. And we'll get into different ways how you can maintain your overall health and how your mental health relates to your overall physical health. But
So that's mental health.
yeah.
Now we're going to talk about mental illness.
Yeah, so mental illness, so the difference with that, mental illness refers to conditions that affect a person's thinking, feeling, mood, and behavior. So again, very similar, but again, a mental illness is an actual diagnosed condition somebody may be experiencing. People can experience different types of mental illnesses or disorders, and they can often occur at the same time. So an individual could have an anxiety and depression at the same time. And so mental illnesses can occur over a short period of time, or be like short episodes. So you hear a lot of times like a manic episode. And this means that the mental illness comes and goes with discrete beginnings and ends. And it can be ongoing or long-term. So for example, some mental illnesses that many people experience, we have stress, anxiety, schizophrenia, depression, personality disorders, and sleep disorders. And I wanted to say with that stress, mentioning stress, stress is an everyday occurrence. We are meant to feel stress. Years ago, if you think of the first humans, if we didn't have stress, we probably wouldn't have ran from a tiger, you know? So it is an everyday thing that people go through, but it's all about knowing what symptoms to look out for, if they're lasting too long, when to get help. But I do think it's important to say that it is so normal for everybody to experience periods of stress, periods of sadness, because life is uncontrollable.
Absolutely. And periods of anxiety.
Yes, yes.
So let's talk about the differences.
Yeah, so the differences between the two. So, although the terms, again, are used interchangeably, poor mental health and mental illness are not the same. A person can experience poor mental health and not be diagnosed with a mental illness. Likewise, a person diagnosed with a mental illness can experience periods of physical, mental, and social well-being. So that's on the next slide, I actually have a chart that compares the two. So our mental health, again, is a state of overall well-being where each person fulfills their maximum potential. So you are feeling good, you want to go out and enjoy the day. And again, you will have periods of sadness, but overall you are enjoying your life, you're enjoying your social interactions. And it all depends on the individual, because you might like going to a big party where I may like to hang home with 3 people. So like it all depends on that person, what they enjoy. So mental illness, on the other hand, so this is a diagnosable health condition characterized by a set of signs and symptoms. Usually mental health professionals use specific criteria to diagnose. And a lot of times mental illnesses, they require intervention. So whether that's medication, therapy, group therapy, there's a lot of different interventions people can seek. But again, your overall well-being and mental health is your day-to-day, how you're going through life, how you're handling stress, whereas a mental illness is a condition, if it's chronic and you really can't get by, and you can't get out of bed in the morning, that's when you kind of go and seek professional help. And we'll get into that a little bit later in the slides.
I guess what folks should be aware of too is folks shouldn't, I guess, disregard medication, because it's basically, you have to look at it as a potential chemical imbalance.
Yes. So a lot of mental illnesses are just that, a chemical imbalance in your mind. So some, depending on your condition, you may need medication. Some people can go through periods where they don't need medication as long as they're self-managing and doing coping mechanisms that work for them. But it's very individualized. So my favorite thing to say, please check in with your doctor. And a lot of times doctors now at your annual physical, they will inquire, how is your mental health? Do you think you need to talk to someone?
Right. Yeah, it's great that you said that, because now my yearly physical for the past couple of years has included that aspect.
Yes, yeah. And I always, I'm a big advocate for talk therapy. Sometimes you might not find the right person off the bat, but you can change counselors until you find somebody that works for you. But it's nice to have an outside source away from your problems. It's not a family or friend, so it's not somebody who's gonna take your problems and tell somebody else, which happens in life. But I am a big advocate for that, because they can kind of look at your everyday problems and be like, this kind of seems like you should go get tested for that. You may have depression. This may help you. So I think very big advocate for talk therapy. So talk to your doctor, and even if you think you have nothing to say, try one visit and just see. You never know. You might start crying in the first 5 minutes and realize you were meant to be there.
Absolutely. You might benefit from it.
Yeah.
Certainly don't disregard that.
Yes.
Let's talk about causes. I did mention chemical imbalance. That's a potential
Yes.
cause.
So on 4 causes of mental illness, I have like a pie graph that you see it all goes intertwined. So in the very center, we have mental health. So in each circle, so we have your biological, so that's your brain chemistry, whether you have a disability, you have other physical health conditions, that definitely will affect your mental health. If you are feeling sick and lousy, it's not good for your mind. There is also genetic proponents to that, whether your family has a history of depression, that is very large as well. It goes into your psychological, so your self-esteem, your coping skills, your social skills. Social is a very big aspect of that, especially as we're aging. You want to make sure you're keeping in touch with people, whether it might not be a loved one, maybe it's just a neighbor down the street or a church organization or something that individual loves to do. I know I'm a big fan of walking, and walking is definitely good for your mental health, just because it changes your hormones and everything. So I always say like a walking club could be a great thing to do. Also your social behavior, so your family situation, your school situation, your friend groups. And this all, again, goes hand in hand. Drugs, so any drugs you may be on, even if it's not over the counter, but if it's a prescription drug and you're not taking it appropriately, you see that on commercials. They'll say, take this medicine for that, but look out for these symptoms, and the symptoms are very long. And a big thing we look for is any suicidal thoughts or behaviors. So it's make sure you know what you're on for medicine, and you know how it can interact with other medications or vitamins you may be taking. And it all goes hand in hand, and that's why I think talk therapy can be really good, because even like trauma, childhood trauma that you might not even have realized happened, it's really good. And I saw something a quote that I thought was great. It's not about healing the trauma. You know how to deal with trauma already. It's healing to be able to enjoy your life. It's to be able to absorb the good things and
Not
find
to be
the
stuck
joy.
in that
Yeah.
past event. I get
Yeah.
it. Okay.
So again, there's a lot of things that can go into the causes of mental health.
Coping skills, I know one of the things that may come up later on, I'll bring it up now though, is comfort. You hear about comfort animals.
Yes.
That could be certainly something, having a pet that could lessen anxiety, that could lessen depression.
Yes, and it's also important to know, I was thinking of animals on my drive here. And sometimes, like, I met someone at the Kennedy Center, very big animal lover, but at this time in their life, it's not a good opportunity for them to get a dog and to take care of a dog. But I was thinking, even the animal shelters, volunteer at an animal shelter and go for a short walk, or just go and play with the animals. So that's a good point, because I think of my dog at home. I'm like, that is my source. I bring my dog for a walk anytime I'm feeling down.
Absolutely. And I had a pet bird and I had a pet rabbit. They were my sons. But I noticed that just hanging out with them, my son gave very little attention to either. But that, for me, was calming.
Yes, yes. There's something about animals. They just have because they're not talking to us. It's all their actions.
They don't talk back, right?
It's just their actions, and they're just there for us. And so I do think animals is a great coping skill for people.
When my son was not feeling well as a child, oftentimes that was the only time, but oftentimes he would seek out the rabbit or he would seek out the bird.
Yeah.
And that made him feel, he wasn't feeling great, that made him feel better, that made him get through the sickness better, I suppose, right?
Yes.
Let's talk about why mental health is important to physical health.
Yeah, so we have another little chart here. So it goes really hand in hand. Your body is a whole system, of course. So it's very important to maintain your mental health, to create and maintain healthy relationships. So that's meeting people, having conversations to stimulate your mind to do better, to enhance productivity. So productivity and concentration are directly related to mental health. To increase your memory. So it's very powerful for like creating memories and storing memories. To live life to the fullest. So again, I had just mentioned when we talk about healing your trauma, I don't mean to do air quotes on that, but when we're just saying, like, 'cause I'm doing air quotes just because it's a blanket statement.
Sure.
It's again, you are seeking help so you can enjoy your life. You can find the good in little things. To attain a positive self-image, that is one thing in my mental health journey, is trying not to be so hard on yourself, and try to look for the good. I always thought I was so positive, and then I look at the things I'm saying a negative after a negative after a negative. So I'm finally trying to listen to myself and be kinder.
It's funny because I've never seen you in the years that I've known you as a negative person. You always seem so happy, but obviously there's some kind of an inner struggle.
Yeah, and it's not, I like to think those around me, I was always positive to everybody, but I was hard on myself.
Okay.
And I would miss an event and I'd be so mad at myself, and now I'm giving myself some grace, especially as a new mom. You realize you got to slow down and do what you can.
Well, the phrase that we are only human says it, right? I mean, we make mistakes.
Yeah.
We're not perfect.
Yeah, so it's important for everybody at every life stage, especially as a new mom. It really comes to a head, though, because you realize you can't maintain everything. You have to find a balance.
So we're not computers, and even computers malfunction,
Yeah.
right?
And then the last thing we had on that slide is to cope, again, with that stress. So learning coping mechanisms that work for you, and also a lot of research is saying, like, with this high stress, your cortisol levels are up. It affects your sleeping. So we'll go into some different coping mechanisms that can help relax your body.
I think before we get there, we're going to look at symptoms, and I guess through these symptoms, get to know when we need to seek help.
So again, mental illnesses, there are a wide range. This could be a very long series if I went into each single one. But this chart is from the Suicide and Crisis Lifeline, which is actually just 988. But I'm just going to quickly read off this chart, and we'll be able to pull it up on the screen. So it's if you have mild symptoms that have lasted for less than 2 weeks. So this would be considered normal. So you're feeling a little down. You're feeling down, but still able to do your job, your schoolwork, your housework. Some trouble sleeping, and feeling down, but you're still able to take care of yourself. You're still brushing your teeth, showering, washing your clothes. So if this is the case and it's been less than 2 weeks, some tips for self-care. We have exercise, engaging, again, in social interactions, trying to get adequate sleep with a good sleep schedule, eating healthy, talking to a trusted friend or family member, and practicing meditation, relaxation, and mindfulness. If the symptoms do not improve with these measures, you want to then talk to your doctor first. But then we have more severe symptoms, and these would be lasting, again, more than 2 weeks. So that's your difficulty sleeping, appetite changes that affect your weight, so whether you're losing weight unexpectedly or gaining weight, struggling to get out of bed in the morning because of your mood, difficulty concentrating, loss of interest in things you once found enjoyable, unable to perform your daily functions and responsibilities, and especially thoughts of death or self-harm. Contact your health professional right away. If you do feel like it's a life-threatening situation, you could call the Suicide and Crisis Helpline at 988, or you can dial the police and explain what's going on, and an officer can come to your door. I know here in Quincy, we do have 2 mental health clinicians that do accompany the police for different circumstances. So when in doubt, don't sit home alone. Call 911 and get the help you need.
Because as you had mentioned, help is out there, and for folks, realize that you are not alone.
Yeah, and it feels very lonely, because when you're feeling so down and depressed, you feel like, what's the point of going on? People would be better without me. And that is almost never the case. So please seek help. It's scary to get help, but it's very important, and your loved ones will thank you for it.
Well, something you said earlier that I'm going to bring up now is that years ago, to say mental health or mental illness, there was a stigma attached to it. Fortunately, today, that stigma has been removed.
Yeah, I think I can't say my personal opinion on that. So many people are connected now, especially with the internet, and it's just so much knowledge is being spread. So people are finding things out online. Like, for example, like the little videos on Instagram and TikTok. People are looking at those videos and they're listing symptoms, and people are like, I've been feeling that way for years. So a lot with the connection and the research. We always say on these episodes, don't Google your symptoms, don't self-diagnose. But with mental health, sometimes it is a self-diagnosis. And if you can manage at home, that's fine. But again, if you're feeling really down, definitely talk to a professional.
I see what you mean about going on for a while on this topic. I realize we
Yes.
only have about 5 minutes, but let's talk about healthy ways to take care of your mental health.
Yeah, so we can breeze kind of through this, because it is kind of the individual decides what works for them. But healthy ways to take care of your mental health. So deep breathing, that is a huge one. Stretching and meditation. I love with iPhones now and Spotify, you can look on podcasts for different either sleep meditations. I've been listening to one on that actually. And they also have different mental health podcasts that you could listen to, and it's just tips from professionals which I've been finding very helpful. As we always love to say, eat healthy with a well-balanced meal. Maintain your physical activity the best you can. Getting plenty of sleep, that's so important. So if you are not sleeping, talk to your doctor, because it could be different health conditions, it could be medications, so they could try to help you manage that. Drink alcohol in moderation. Avoid misusing prescription medications and mixing them with other medications. Avoid smoking, tobacco products, and e-cigarettes. Continue routine preventative measures, so that's your vaccinations, your doctor's appointments, your dental appointments. We also have make time to unwind. So do something you love, whether that's journaling, reading, painting, crossword puzzles. Connect with others either by phone or look at your community. I know our Council on Aging has endless groups and different people coming in to give education. So that's something good to keep your mind active and keep social. Connect with your community or faith-based organizations, and take breaks from watching, reading, or listening to news stories.
That could make us all anxious.
Yeah, because we are now so connected now that each individual is carrying the weight of the world. So it's a lot, and you can't do much to control all that. But before we go, I did follow, the last slide is just our resources, which were the CDC, the Massachusetts Department of Public Health, and Massachusetts Behavioral Health Helpline. And that is a 24/7 support line. And that full number is 833-773-2445. And you can call or text that 24/7. There's 200 languages. And that is, if God forbid you are feeling very low and you don't know what to do, call and just see what resources may be available.
Very good. Very informative program. Again, I think it could have been broken up into several
Yes.
programs because it's a
Yeah.
real heavy topic. You did it, I would say, more than justice within a half hour. So thank you so much. We will certainly have you back
Yes.
on a different day to talk about a different topic. But thank you once again.
Of course, thank you for having me.
And thank you at home for watching. Just please remember to support the local access center in the community in which you reside. Take, I guess, into account of what was said here today and take good care of yourself.